I'm Elizabeth Galantine, Associate Editor with Employee Benefit Advisor. Today I spoke with Kathryn Wilber, Senior Health Policy Counsel for the American Benefits Council, on the reform efforts on the state level versus federal level. First, Kathryn explained why the American Benefits Council is concerned about state reform.
Very concerned about states taking their own route with respect to health care reform. We've already seen problems come up in the states that have taken that path. Certainly Maryland, which attempted to impose a fair share, pay or play type of requirement on employers. That was struck down by the Federal Appeals Court. We've seen Massachusetts take a more comprehensive approach. That also includes a pay or play requirement for employers, and now particular concern is San Francisco. So we've seen this trend move from a state level of reform effort to even smaller jurisdictions like counties and cities. And when that happens, then employers who are administering a self-insured benefit plan uniformly across state lines, as they can do right now under the current ERISA framework, can't do it any longer. They are forced to comply, unless these laws are struck down by the courts, to comply with each specific requirement in these jurisdictions. And one may impose as Maryland did, a percentage of payroll requirement. You either provide coverage or you pay that amount into the state fund, or like San Francisco, a per dollar per hour. A dollar per hour amount. They may have different reporting requirements and disclosure requirements, and all of this adds up to a tremendous administrative burden with added costs for the employer, disincentives to provide coverage, and these costs are of course passed on to employees. So it's quite worrisome to see that take it as the main path.
Next, Kathryn explains why it's important to determine what the term state reform means before choosing sides.
To understand what is meant when folks talk about we should let the states, experiment, or we should, allow them to continue to do what they do. That can be. We need to, better understand what the specifics are. For example, as I understand it, Utah has some type of state program. They have not gone down the route of a comprehensive reform effort, as we've seen in Maryland, an attempt there in the pay or play, or Massachusetts, or what I just described in San Francisco. What they may be considering or are embarking on is what's called a portal, sort of a connector exchange. There are different words to talk about this. Public program is another sort of word that's being used. Depending on how you structure them, that entity can look quite different. For example, if you're really talking about a portal or a place of access for consumers to maybe use a website where they can go and get information and compare quality and cost among insurance products, and make purchasing decisions and get other types of education that will help them be better healthcare consumers. That's different from an entity that would actually offer insurance itself that the government is running. And the Republicans have expressed a lot of concern about that type of entity, a government-run insurance program that sits alongside and competes with other private sector insurance companies. I think that Senator Hatch sort of is more favorable to sort of the access portal and not that more comprehensive, risk-bearing sort of insurance entity end of the spectrum.
Next, Kathryn shares why she thinks something like an insurance portal could actually work on the state level.
This has been a very controversial issue of late in the healthcare reform debate. It really, it's specificity around the term here is. We just need to, understand what someone's talking about when they refer to what do you want a state to do. It's important to understand what's meant by that in order to assess how it's going to impact an employer. It's employers' a portal, access only sort of place to go to get that kind of information when you want to compare insurance products is, I think, by and large, can be very useful for consumers. But, you know, the other end of that spectrum, in a government plan that actually provides coverage and is a competitor is a bigger problem. Many people believe that they're not going to be a true competitor. There won't be a level playing field. They'll be able to set prices, reimburse perhaps at lower rates, and you know, we've got concerns about what does that do to the insurance market and the ability of the other companies to truly compete.
Lastly, Kathryn shares her thoughts on whether or not federal reform will affect what's already been done on the state level.
We have not yet, I think, heard how whatever evolves here at the state level, and we've got lots of ideas on the table, but it's not at all clear yet what's going to come out.